Hello, I'm George Sawaya from the Department of Obstetrics, Gynecology, and Reproductive Sciences, and from the UCSF Center for Healthcare Value. I'm joined today by Chris Moriates, a hospitalist in the Department of Medicine and also from the center. Today we're going to present the fifth module in the CPI 101 series entitled An Introduction to Healthcare Value. By the end of this module, learners will be able to define healthcare value, recognize common areas of waste and overuse, and improve value by engaging in conversations about healthcare value. In prior modules, we discussed patient safety, quality improvement, and patient experience. But there's another very important aspect of healthcare, and that's the cost of care. Healthcare costs are bankrupting individual patients and taken away from other societal priorities such as infrastructure, education, and business competitiveness. In fact, every year in the United States, about $750 billion is spent on healthcare that's not making people better. In order to make care more affordable, more convenient, and safer, we have to think about the root causes within our system and try to change those. The concept that brings together cost, safety, quality, and patient experience is called healthcare value.
High-value care typically refers to maximizing the quality divided by cost equation. In other words, trying to provide the best outcomes and patient experience at lower costs. If you think about it, quality divided by cost is really how we think about most decisions that we make. We all know that a 3-star Michelin restaurant is going to cost more than the corner cafe. The question is, when is it worth it? Just like healthcare value, it depends on context. If you're celebrating a special event, say a 10-year anniversary or something like that, then perhaps the fancy restaurant is what you want. But if you're just looking for an everyday dinner, then corner cafe is your best bet. The distinction between cost and value is critical. Some high-cost interventions can be high-value care if used in the correct setting. For instance, a few years ago I had a patient who I worried may have had an infection around her spinal cord. I had to coordinate an ambulance and a nurse to transport her across town to the larger MRI scanner. The cost of this must have been staggering. But it turned out she did have an infection and she needed neurosurgery. That test was extremely valuable at that time. And it probably would have been, even if it did not show an infection, since it would have given us important information. However, that same test, an MRI of the back, is low value when used routinely for common low back pain, since it does not improve outcomes in patients who don't have concerning signs or symptoms. Though healthcare value often seems to be defined from the health system perspective, viewing it through the eyes of our patients is a way to align all of our interests. From our patient's perspective, value means integrating patient safety, quality, experience, and affordability. More simply, once again, it means striving to provide the best care at lower cost.
The easiest way to improve value is to decrease our use of medications, tests, and procedures that are simply unindicated and don't make people better. As you recall from the first module, waste is anything that does not add value for the patient, such as unnecessary lab testing. According to a recent survey, nearly half of primary care physicians in the U.S. believe patients in their own practices receive too much medical care. One common source of overuse is antibiotic prescriptions. Unnecessary antibiotics place patients at risk for dangerous infections such as Clostridium difficile. Nevertheless, nearly 3/4 of patients with acute bronchitis, a condition that does not routinely warrant antibiotics, are prescribed them anyway. Another area rife with overuse is medical imaging. This past year, 97% of emergency room physicians said that at least some of the advanced medical imaging studies that they order, such as CTs and MRIs, are medically unnecessary. CT scans expose patients to radiation that may place them at increased risk of cancer. The sobering reality is as much as 1/3 of healthcare may not make patients any healthier, and a substantial proportion of that care may actually be causing harm.
Let me tell you a real example. While rounding in the ICU a few years ago, I saw my patient from the doorway and immediately knew something was wrong. "I feel like I'm gonna die, doc," he said, and he looked like he might be right. He was bleeding, hemorrhaging from his stomach. His blood pressure was low and dropping, his heart rate climbing, and he was fading into that cool, lifeless pale. Luckily, we were able to get the blood quickly and rush it into his veins. The care he received clearly saved his life that day, It felt great. To those of you that have donated blood before, thank you. You're a hero. You may have saved someone's life like my patient. But unfortunately, the vast majority of blood that we transfuse does not save lives. In fact, a small proportion of it can cause harm. Can you imagine taking the time out of your day to donate blood, and that selfless gift not only doesn't help a patient, but may actually cause harm? It's a triple fail: decreased patient safety, a waste of precious resources, and increased costs. At UCSF, we introduced a program to decrease the amount of unnecessary transfusions that we provide. We were able to make a significant impact, improving patient safety and saving an estimated $3 million so far to date. This is just one example in medicine where less may be more, where the right amount of medical care is miraculous, but too much of it can cause harm.
What can we do at UCSF to improve healthcare value? At UCSF, we take healthcare value seriously. The UCSF Center for Healthcare Value was established to change the culture of medicine at UCSF and beyond. We do this by making sure that healthcare value is a fundamental component of all activities at the university, including research and policy, training, and delivery systems. This includes clinical care. The center is a clearinghouse for all things related to healthcare value, and it strives to assure that educators and clinicians can improve the value of the care that they deliver. For example, UCSF pharmacists have led an initiative to improve healthcare value, specifically by transitioning patients from IV medications to medications taken by mouth. This transition was not only good for cost, because IV medications are much more expensive than medications taken orally, but it's also better for patients who don't have to have an IV pole hooked up to their arm. This is an example of UCSF pharmacists leading the way in making changes that improve healthcare value. The Lean team here at UCSF has also helped make our work more efficient. For example, they worked with the transport team to determine standard work that ensures all the right steps are followed no matter who is doing the transport. Along with other improvements in staffing, this program led to greater transporter productivity and reduced time to complete transports. Prior to this program, a nurse and patient could wait up to 90 minutes for the transport to be completed. This time is now much more consistently 30 minutes or less. On the national level, the ABIM Foundation's Choosing Wisely campaign has brought attention to the harms of healthcare overuse. The Choosing Wisely campaign has enlisted 70 specialty medical organizations, including nursing and physical therapists, in coming up with a top 5 list of things that clinicians and patients should question. Consumer Reports has teamed up with Choosing Wisely to create resources directly for patients. Here at UCSF, we have highlighted the Choosing Wisely program by engaging medical students as high-value care advocates while working in the hospital. In this role, students learn about the medical decisions that should be questioned and keep tabs on how well they are being considered in actual patient care. By calling attention to these areas, the trainees become important agents of culture change. When we think about value, the types of questions that are important to patients that we all should be asking are, how would this test or treatment help? Are there any other options beyond what was just recommended? What are the risks of these tests or treatments? What would happen if we did not do anything? Clinicians can explain why they do not believe that a test will help a patient and can share their concerns about the potential harms and downstream consequences of a given test.
While many of these emerging efforts have focused on physicians, there's a clear need to train all members of the interdisciplinary team. Just as a single individual who fails to wash their hands may undo the diligent compliance of everybody else, the efforts of some clinicians to cut wasteful practices can be quickly undone by those who don't have the same knowledge or skills or ways of communicating with our patients. Let's consider the role of interprofessional communication. We see how the patient is experiencing healthcare from our own unique perspectives and bring our own professional knowledge and skills to bear. No matter what our role is in caring for patients at UCSF, we can all consider a few questions to each ask each other to open up the conversation about value. First, what's going on? Unless it's a true emergency, we can all stop and ask what is happening to our patients. For example, we all know that patients confide in nurses information, opinions, hopes, and fears that they may not feel comfortable disclosing to other members of the health professional team. By eliciting this information, we can all ensure that we're not only providing patient-centered care, but high-quality, high-value care. What seems wasteful or unnecessary for this patient? Simply asking this question will often yield thoughtful insights. Nurses may point out that a patient is ordered for routine daily labs and may ask whether that's necessary since the plan is for discharge the following day. Perhaps the patient care assistant can note that the patient had been awoken for vitals every single night despite being low risk. And pharmacists can help us all identify medications that are unlikely to be meaningfully benefiting our patients while they're here in the hospital. These are all examples that can improve the value of care that we provide to our patients. Remember from prior safety modules that we all have a responsibility to stop the line if we see something that's wasteful or causing harm for our patient. What else can we do instead? Prior to adopting an intensive therapeutic or management strategy, consider whether a less intrusive or less expensive alternative can be delivered. For example, instead of immediately ordering a sitter for a patient at high risk for delirium, a discussion between a physician and a nurse can help determine whether the patient can be verbally oriented, whether there are family or friends who can be engaged in visiting the patient and reorienting them often, and whether sleep disruptions can be minimized.
While changes on the national and local level may incentivize system-based solutions to problems related to healthcare value, the truth is that we really need to start with ourselves. Think about the green movement over the last few decades. Sure, we really needed structural policies and initiatives, but we also took individual responsibility. We shifted culture so that if you were to be seen littering today, you would likely be more than just embarrassed. Do we feel similarly when we waste healthcare resources? Just like the green movement, the need to address healthcare value has become an imperative of our time. There are many foundational steps, including education, price transparency, and systems changes that need to be firmly in place. We know that there is no magic bullet. It will take the sustained efforts of clinicians, patients, and systems. Most important, we all need to pitch in with an all-hands-on-deck mentality to bring about the change we need.
Currently, medical care in the United States is characterized by widespread overuse, which leads to countless direct and indirect harms. Confronting such a large problem will require all of our efforts. Curbing medical overuse, especially in areas that lead to clear damages for patients and communities, such as unnecessary blood transfusions, is part of our professional responsibility. We can all do better by understanding and talking about healthcare value, striving to provide the best care at lower cost for our patients. There are a number of resources here at UCSF to help us with this work. Thank you for joining us.